Did you know that there's a respiratory virus silently spreading across the globe, causing severe illness in certain populations, yet often overlooked in favor of more prominent diseases like the flu or COVID-19? Meet Human Metapneumo Virus, HMPV, a virus that, despite its relatively recent discovery, has become an emerging concern for healthcare professionals worldwide. Stay tuned to learn how this virus spreads, its symptoms, and what you can do to protect yourself and your loved ones. In the vast landscape of respiratory illnesses, one virus has been steadily emerging from the shadows: Human Metapneumo Virus, commonly referred to as HMPV. Despite being identified relatively recently, HMPV has become a significant focus for healthcare professionals and researchers worldwide. In this comprehensive exploration, we will delve deep into the origins, characteristics, transmission, symptoms, recent epidemiological trends, and preventive measures associated with HMPV. Human metapneumo virus was first identified in 2001 by a team of Dutch scientists. Through meticulous research, they discovered that this virus had been circulating in human populations for decades, eluding detection due to its similarity to other respiratory pathogens. HMPV belongs to the pneumoviridae family, which also includes the respiratory syncytial virus, RSV, another notable respiratory pathogen. The virus is enveloped and contains a single-stranded RNA genome, classifying it within the same family as several other respiratory viruses. Genetic analyses have revealed that HMPV can be divided into two primary genetic lineages, A and B, each further subdivided into sublineages A1, A2, B1, and B2. This genetic diversity contributes to the virus's ability to evade the immune system and presents challenges in developing effective treatments and vaccines. Transmission of HMPV occurs primarily through respiratory droplets. When an infected individual coughs or sneezes, tiny droplets containing the virus are expelled into the air and can be inhaled by those nearby. The virus can also survive on surfaces for extended periods, making it possible to contract the virus by touching contaminated surfaces and subsequently touching the face, especially the nose, mouth, or eyes. This mode of transmission underscores the importance of maintaining good hand hygiene and avoiding close contact with individuals exhibiting respiratory symptoms. The incubation period for HMPV, which is the time between exposure to the virus and the onset of symptoms, typically ranges from 3 to 6 days. Symptoms can vary widely in severity. In many cases, individuals experience mild cold-like symptoms, such as cough, nasal congestion, sore throat, fever, shortness of breath, wheezing, headache, fatigue. However, in certain populations, particularly young children, the elderly, and individuals with compromised immune systems or underlying health conditions, HMPV can lead to more severe respiratory illnesses. These can include bronchiolitis, which is an inflammation of the small airways in the lung, pneumonia, a lung infection causing inflammation of the air sacs, and exacerbations of asthma or chronic obstructive pulmonary disease, COPD. It's noteworthy that most children have been exposed to HMPV by the age of 5, often resulting in mild illness, but the virus can cause repeated infections throughout life. Recent epidemiological data has highlighted a surge in HMPV cases in various regions. In northern China, health authorities have reported a significant increase in respiratory infections, including those caused by HMPV, since December 2024. This rise aligns with the typical seasonal patterns observed during the winter months, a period when respiratory viruses are more prevalent. The World Health Organization has noted that these reported levels are within the expected range for the season, and there have been no unusual outbreak patterns reported. Similarly, in the United Kingdom, the UK Health Security Agency observed that as of January 13th, approximately 4.9% of hospital patients tested for respiratory infections were positive for HMPV. This data indicates that while there is an increase in cases, it remains within the anticipated seasonal activity. It's important to contextualize these findings. Experts emphasize that HMPV is a known seasonal virus, and its current activity is within expected levels. Unlike the COVID-19 pandemic, HMPV does not pose a similar global threat. The virus has been circulating globally since its identification, and while it can cause severe illness in vulnerable populations, it does not have the same pandemic potential as novel viruses like SARS-CoV-2. Public health authorities continue to monitor the situation closely, but there is no cause for alarm at this time. In conclusion, while Human Metapneumo Virus may not pose a global pandemic threat, its impact on vulnerable populations cannot be ignored. With the rise in cases, particularly during the colder months, understanding HMPV's transmission, symptoms, and prevention strategies is more important than ever. Stay informed, practice good hygiene, and if you or your loved ones show symptoms, don't hesitate to seek medical advice. Remember, early detection and care are key. Thanks for watching, and make sure to like, share, and subscribe for more health insights.